we visited accident and emergency. I came with my husband, who has many illnesses. So he has rheumatoid arthritis, osteoarthritis, chronic pain syndrome, type 2 diabetes, chronic heart disease, and he had a drug-eluting stent fitted in 2010. He has hypothyroidism, hypertension, osteoporosis. He had 2 spinal fractures in 2010. He has spondylosis. He had an episode of pancreatitis about a year before this visit to A&E. He has IBS. He suffers greatly with constipation caused by his medication. He has repeating issues with thrush in his mouth. He has varicose eczema. He wears dentures because his teeth literally just keep breaking because of all the medication he's on. He also is not neurotypical, and he lives as a recluse. He has a personality type which makes him quite angry, and it precludes him from interacting with other people. He has anger and rage issues, which can be triggered by activity that doesn't seem to be of great consequence to other people. Therefore, you can imagine how difficult it is for me when I bring him to A&E. Now, on this particular occasion, an increased episode of COVID, there were signs up all over A&E saying that people should wear masks. With his great list of illnesses, he's very concerned, as am I, about catching COVID, and yet hardly anybody in the department, including doctors and nurses, had masks on. So we didn't want to wait inside the department. We were told, therefore, we would have to wait outside. We arrived at 7 p.m. We were still waiting outside. Nobody told us we could wait in our car and be phoned. My husband, with all of these issues, he's a wheelchair user, in the cold, freezing. We had 3 times I had to come and ask why nobody came to see if we were okay. And frankly, the receptionists were very kind and fine and understood the situation. But at one point, the receptionist went off duty, and somebody who looked like they were in a nurse's uniform came onto reception and was very flippant and dismissive of my concerns. I had written down all of those illnesses that I'd just listed, and we handed that list to the lady. So when we finally saw the doctor, none of those illnesses had been listed down, and the doctor didn't have a record of any of them. And you can imagine, with my husband's anger and rage issues, he was really angry, and I'm trying to mediate between the medical staff and my husband, make sure my husband gets looked after properly, and I feel like I'm having no support from the staff at this. Felt like he was getting pancreatitis again, which was incredibly painful for him, and it made him feel like he was going to have a hospital stay. Is one of the worst things that can happen to him. He doesn't want to be away from me, and he doesn't want to be in hospital with other people, and he doesn't want to catch COVID, and nobody cared. The staff were completely insensitive to his needs. Eventually, a medical student came out to see us and called us in, but he asked us again what the problem was. He didn't have a list of the things that we'd given over. He wasn't equipped to deal with what the problem was, or with my husband's anger, to be frank. He went and got another member of staff, and I was trying to placate my husband at the time. Another doctor came in and again asked him what was wrong. Nobody's concerned about his fears. Nobody's concerned about the fact that he has mental health issues as well as physical health issues. And in the end, we left A&E, and he was never treated. Thankfully, the pain went away. We spoke to the nurse in charge and explained to her that we understood that people are pushed to their limits, but people could take some time to understand people's needs, and that was not considered at all in our case.